But again, your shoulders, your biceps might get tired because again, you're putting the brakes on, you're not used to it, but it will settle itself out over the course of a month, 2 months, 3 months, where you'll feel 100% comfortable and fine. And it'll make your running so much better. And so much less effort required in your running.
Long distance. So is that normally anything you guys do for us for outdoor and indoor track?
It depends on some days, it just depends on the day. We kind of mix it, so there's always some distance component for everybody. Yeah. And usually those are we worked with another like kind of trainer coach for a little while, and he had a lot of really good stuff. So he calls them flow workouts, right? So it's basically doing pick a time, amount of time that you're going to go out and train for, and you're going to mix together all sorts of different components. So part of it you're going to be doing. Why is this thing so up in the air? Oh, you know what? Yeah, that's better. You can let it settle down. No, it's fine. Right there is good. It's just a little lower. Maybe a little closer. Yeah, sorry. So you'll pick an amount of time. And is it on and everything? Okay, yeah, just see if there's anybody on there yet. And if anybody is on there, welcome. We're going to get the camera hooked up in a second. I'm just getting the table opened up, and we'll get going. But so let's say you're going to run for half an hour, 45 minutes, whatever it is. So it's a little bit of a longer run. But you're going to maybe do some varying time intervals where you'll maybe jog for 5 minutes, and then for a minute you're gonna just bring your speed up a little bit to where you're starting to get a little bit out of breath, and then you'll go back down for 2 or 3 minutes to a conversation pace, you could hold a conversation, and then maybe do a 2 minutes of race pace, you're gonna push a little bit, then back down, and it's just there's no right or wrong. It's just decide kind of ahead of time. In this particular workout, how much of it do you want to be hard and how much easy? So if it's an easier day, maybe out of the half an hour, only 4 or 5 minutes are challenging, right? And the rest of it's low. On a challenging day, maybe half of it is challenging and the rest of it is low. And then, depending if you're using a heart rate monitor or something, then you can start really dialing it in because you could keep it at aerobic thresholds where you're, only using aerobic energy sources and your heart rate's a little lower, and then periods where you're going to bring it up to lactate threshold, maybe a little bit above lactate threshold, and you can really start dialing it in. And those workouts, so effective. So I didn't personally, but my son did. So I just went off of his, we were training for him. Yeah, we were running together. So he would use his heart rate, and I would just do whatever he was doing, and it worked out. I mean, there are times when he's my son's resting heart rate's 38. It's pretty low. Yeah, he's pretty fit. And so there are times when I would probably be pushing it a little harder than him, but it's okay. It was close enough that it was fine. But ideally, I would have got my own. I just didn't. When we were training, but yeah, that'd be the way to go. So we good? Some people are on there. All right, cool. All right, let's get going. Yeah, when you guys come on the stream, Alex and I might be talking about Alex is running a bit more, so we're just kind of talking about running technique and different things that you can do. And I think I had mentioned this to most of you guys that first day that I do, I coach running, and I also have coached strength training in the past and powerlifting and all that kind of stuff. So just kind of talking about that stuff. And if any of you guys ever have questions about those types of things, I'm happy to help. I'm by no means, the be all end all on that stuff, but I do have a lot of experience and I can help out a lot with training and any issues that you guys might be having or ways to get past sticking points that you guys have, in your training and everything. So, all right. So we're going to be on the anterior side today. So we finished up the back muscles last time. So this time we're going to be going through anterior side muscles. We're going to start with all the muscles, but we also are going to do a little bit of osteology, and there's some other kind of structures and stuff on the anterior side that we're going to be hitting, some glands and some cartilages and stuff like that we're going to see. So we're going to kind of finish up as much of that as we can, and we should get through all this. So I don't know how long or short today is going to be. We'll see. We'll see how long it takes us to get through, and then next time we will be in the thoracic cavity, okay? And then at some point over the next time or two, we're going to see the brain. It just depends on how the dissection goes, when that's going to happen, but we will get to that as well. So I'm just kind of repositioning here. I'm going to reposition again in a second. Just want to get us close. All right, so that looks good. So the focus does not seem to be going. So, so to leave that one on.
Like this, right? On auto.
Is that the focus or the white balance? Just hover over.
You're right. Whoops.
The other one.
Yeah.
Down. Yeah. Okay. There we go. Perfect. All right, now we're good. All right, so we're going to start on the face. So we're going to kind of begin up here, and then we will move down. So, like that. So let's get him uncovered here. All right. And I just need my instruments. And I think that's good. Okay, so you can see right now he's face up. I have the skin at least off of half of the face. I am going to get the other side done as well, but since, we're here and the camera's only on one side, I'm trying to do one side like really, really good, and then I'll get to the other side when I can. So right now, with him being face up, I'm standing here looking at the right-hand side of the body. Okay, so I'm standing on the right, looking in on the right. I'm going to end up moving the camera down so we can see a little bit more of a side profile here. But you can see we left a little bit of skin around the nose, a little bit of skin around the lips, and we can see that we still have the skin on the ears. Everything else has been taken off, maybe just a tiny bit around the eyes here, right? So we're going to go over some of the face muscles first and some of the cranial muscles. Now, what you want to know is that we have two different types of muscles here up on the face. We have expressive muscles and we have functional muscles. Now, everything we did last time, they're all functional muscles, all right? They're ones that actually move the body around. They change the position of bones in your body. Expressive muscles, and those are the ones we're going to start with here, they don't actually change the position of your body, right? So the bones are not going to move around here. You're not going to be like opening and closing your mouth. You're not going to be moving the skull around or anything like that. So all the bones, your skeletal system is going to remain in place when we use expressive muscles. The thing that's going to move when we activate expressive muscles is going to be your skin. All right, so expressive muscles move the skin around. They don't move the bones around. And those are going to be all the muscles we're going to start with, or all your expressive ones. Then we'll go to the functional muscles, and then we'll kind of work our way down. All right? So I think, and if I turn that, I'm going to move just a little bit in like this. Let's see. This is going to swing out a little bit. Yeah, that's pretty good. Farther. Something like that. All right, let's see how that is. Okay. So, starting with the expressive muscles. First one we're going to do is one called Epicranius. Epicranius. And this is a muscle. Think of the name. Epi means above. Cranius is with reference to the skull, to the cranium, right? So epicranius is going to be a muscle that is on top of the head here. And it starts right about where your eyebrows would be, okay? So that is going to be on the supraorbital ridge, all right? And that's the bony ridge that's basically at the top of your eye socket, the supraorbital ridge, right? So we're going to begin there. And again, that's right where your eyebrows are. And we're going to go up and over the top of the head. So we're going to go up over the frontal bone and the parietal bone, and then back here to the occipital bone back here. And it's going to end on the back of the head on the superior nuchal line. All right, so I'm going to mention a little bit of osteology here, and I'll bring over a skull too to show you some of this stuff. But the superior nuchal line is a ridge that's on the posterior side of your skull. All right, so basically right now, reach up around the back of your head, and right in the middle of the back of your skull, feel for that bony knob that sticks out. If you reach around a little bit, you're going to feel a bump that sticks out in the back of your head. I had mentioned this last time, but we'll talk about it again. That's called the external occipital protuberance. External occipital protuberance, right? That's that bump on the back of your head. And if your finger is on that particular bump and you just move to the side, so you stay in line with it and you just kind of move your finger side to side, you're running right along the superior nuchal line. All right, so the superior nuchal line is in line with that bump that's on the back of your head, that external occipital protuberance. Okay, and you want to note that any muscles, right, that occur up here on the skull, that they will only go up to that superior nuchal line on the back, but they won't cross it. Similarly, posterior neck muscles like we did last time, like trapezius and splenius capitis and stuff like that, right? As they're going up and attaching to the skull, they will make it potentially up to that superior nuchal line, but they won't cross it, all right? So that's kind of a spot that's going to separate neck muscles from skull muscles. Nothing's going to cross that line there, at least none of your muscles anyway, all right? So we have this kind of band, all right, this strap muscle that goes, again, from where your eyebrows are up and over to the back of your head, like this, right? A band. And we have one on either side. So we have one on the right side, and we have another one on the left side over there. Now, I'm just going to turn the camera so we can look this way a little bit. And I want you to note that these expressive muscles are very thin and small, right? Because, again, think that they're only, sorry, let me see if I can get this a little better. I want it to be like this. There we go. They're only moving skin around, right? And they're attached to the skin. So they're very thin. They're not thick at all. But hopefully right here, let me use the probe. See this color change? Right here. So here is a muscle belly that I'm kind of outlining here. So again, here's where your eyebrows would be. This is where the muscle starts. These are muscle fibers, all the darker stuff coming up here. And then where it becomes lighter back there, those are tendinous tissue. So we got the muscle belly here, we got the tendon here, right? Now what I want you to notice is if we followed this all the way back to the back, and I don't know if I can get the camera in the right position for this. Let's see. Maybe I can. I'm going to try. And if not, you're going to have to take my word for it because I don't know. Yeah, this might be. Let's see if we can do this. Maybe. There. Let's see if we can turn the head a little bit. See, I don't know. Oh, yeah. No, we can see this. All right. So look right here. So again, here was that spot I was just showing you. So there's the muscle belly. Here's where it switches to that tendinous fibers. And look at how it's whitish all the way here, still tendon, tendon, tendon. And then right there, you see how it darkens up? We can see that, right? Right in here, I'm going to outline it for you. Right there. See, we have some darker tissue there again. See how it's lighter and then darker. So there's another muscle belly right there. All right, this is all one muscle, all the way around. It's a band that goes all the way up and around, but it has two contractile parts. All right, it has a contractile part in the front here, then tendon, and then another contractile part in the back. All right, now let me just get back to where we were. I'm just going to kind of move back up to the front here. Like that. All right, so again, we're looking down on the top of the skull. So we say that this epicranius muscle that's going over the top of the head is segmented. All right, segmented muscles have multiple contractile parts. All the muscles that we did last time, they were not segmented. They just had one contractile part, right, or what we call like the muscle belly. So most muscles go from an attachment point to a tendon to a muscle belly to another tendon to another attachment point. That's most muscles, right? Segmented muscles, though, go attachment point, tendon, muscle belly, tendon again, then another muscle belly, then maybe tendon again, then an attachment point. And there might be multiple segments. So the muscle that you're most familiar with that is segmented is your rectus abdominis muscle, all right? That's your six-pack muscle. So think, people when they contract their abdominals and you see that six-pack on the front, right? And it has all those bumps in it. And a six-pack would, for most people would have 3 bumps on each side. That's a segmented muscle with 3 contractile parts there that you're seeing, right? Now I'm gonna demonstrate that when we actually look at his abdominal muscles. Next week after, we'll start to get to the abdominal cavity, right? And I will show you that. You're going to see those segmented muscles. But we have a couple segmented muscles in the body. And again, it just means that it has multiple contractile parts in one muscle. All right? So epicranius, again, we said has 2 parts. This part here is going to be the frontal belly. Okay? And that contractile part I showed you on the posterior side is going to be the occipital belly of epicranius. Now, you will also see epicranius sometimes in certain texts referred to as 2 separate muscles. It's really not. It's not 2 separate muscles. It's one muscle with 2 contractile parts. But some texts treat it as 2 separate muscles, and they will call it frontalis and occipitalis, right? Instead of calling it epicranius, frontal belly, occipital belly, or frontal part, occipital part, So you can refer to it either way, but the way I usually do it is epicranius with frontal belly and then the occipital belly back there. Okay, so again, I've just taken a couple of seconds to describe to you what a segmented muscle is. And we're going to see another segmented muscle today. Well, actually, more than one. So just so you're aware of what that is, right? So what does this muscle do? Well, we already said that expressive muscles like this one move the skin around. So imagine if this muscle here, if you contracted the skin, right, above your eyebrows, what happens? Your eyebrow moves up, right? So when you raise your eyebrows, that's going to be contracting the frontal belly of epicranius. And then that part that was around the back, right, if we contract the skin behind your ear, what happens? If you can do this, and not everybody can voluntarily do this, but if you can, you might wiggle your ears, you might move your ears posteriorly a little bit, and or you may wiggle your scalp a little bit. So you might pull all the skin up here on the top of your head posteriorly like that. So it might move your scalp like back a little bit. And sometimes it does both of those things. So I would imagine out of the people that are listening, what do we got? We got 14 people on here, right? I'm going to say that probably, maybe 2, maybe 3 of you can wiggle your ears, right? Voluntarily. And that's pretty typical. And it's because of one of 2 things. Activating the occipital belly of your epicranius muscle may be something that you just literally have never tried to do voluntarily. You just may have never thought to say, hey, can I wiggle my ears? Let me try it, right? You just may not have tried it. And because of that, the neuromuscular connection to that part of the muscle is atrophied, and it's really hard to activate it. Now, if we put like muscle stem or something on that part of your scalp, we might be able to activate that muscle and cause that skin to jump a little bit. Now, another possibility is that you are missing that part of the muscle, or that it's so small or underdeveloped that it's really not going to activate, right? And that's fine. There's a lot of variability in your expressive muscles. And you're going to hear me say variable muscles a bunch of times throughout the semester. And that just means a variable muscle is a muscle that may or may not be present in your body and or may not be well developed on your body, right? So most of us have most of the muscles in our body, right? So you think about like something like biceps, triceps, trapezius, latissimus dorsi, some of the ones we went over last time. Those are ones that you're going to find that muscle on every single cadaver that you look on. Everybody has those muscles. Of course, it's always possible to be missing one of those, but it's very, very unlikely to be missing one of those. Our expectation is that it is present, it's well developed, it works, right? Variable muscles, the expectation is that, well, I wonder if it's there or not. It may be there, it may not be there. It might be very, very atrophied, like very underdeveloped, or it might be missing altogether, right? And that would be normal. You know, so all of us have some muscles that other people don't have. All of us are missing some muscles that other people have. All right, that's normal. There are certain muscles that are just inherently variable. All right, so you're going to hear me kind of categorize them as variable as we go. You can make a note that all of your expressive muscles are variable, all of them. All right, you may have extra expressive muscles that nobody else has, that there's no name for. You might be missing some of the expressive muscles that other people have, and that is normal. That's what makes your facial expressions unique, in that the distribution and the presence or absence of these muscles and the development of these muscles is so highly variable, right? Again, that's what makes your facial expressions different from somebody else's facial expressions. All right, so just kind of note that in general, all the expressive muscles are variable. One of the more variable parts, again, is that occipital belly of the epicranius muscle. Okay, so that takes care of that one. Now we're going to move back over to the side here. So let's get this back in position. Do it like this. Back out a little bit more. Okay. That's good. Slide down a touch. All right. So we're looking back at the side of the face. The next muscles we want to talk about are two circular muscles, and they're going to be Orbicularis Oculi and Orbicularis Oris. Orbicularis Oculi and Orbicularis Oris. So you hear the name Orbicularis, right? And it's making you think circular, and these are circular muscles. So we have one, this guy right here that I'm kind of moving the edges of. And let me just use my forceps here, right? So you can see this muscle that I'm kind of lifting up here. You can see the bottom edge of it there. And this makes like a raccoon patch around your eyes like this. And that's going to be Orbicularis Oculi, right? So here's the edges of it, right? And it literally surrounds the eye on either side. That's Orbicularis Oculi. And then around your lips, and we can see a little bit of it here. See some of this muscular tissue here. This is going to continue up and around, and it's going to surround your mouth like that, and that would be Orbicularis Oris. Now, understand that when I show you these muscles, you can see up here that it's really hard to see, like, where's the edge of Orbicularis Oculi versus the frontal belly of Epicranius, right? They kind of look like they run right into each other. And there is overlap, and there is crossover between those muscles where some of these fibers do connect to some of those fibers, right? Where there's not a nice, clean delineation between those. So that happens a lot with your expressive muscles. So note that when I ask you these, I would say, you know, I'd hold up and I'd say, identify this muscle here, and I would kind of outline the edge of it like this, so you know which one we're talking about, instead of saying, what's this muscle here? You know what I mean? Where it's like, I'm not exactly sure what he's pointing to here or there. If I want Orbicularis, I would be like this. If I wanted the epicranius muscle, I would say I want this muscle. You know, starts here, goes up this way, and I would kind of outline it like that. And again, I would show you that other view. But, you know, then if I was pointing up here, you go, oh, okay, that's frontal belly of epicranius. If I'm saying identify this muscle here and surrounding this area, then you would know I'm around the eyes. That would be Orbicularis Oculi. So don't panic too much. Understand that this is about as clean as we can get the facial muscles. They're not going to be super duper crystal clear what's what. I will point to them, I'll outline them, and you're going to kind of look at where does it come from, where does it go, what is it attached to, and that'll help you figure out which muscle it is. All right. So again, we had Orbicularis Oculi, Orbicularis Oris surrounding the mouth. And really, Orbicularis Oris is really hard to see the edges of this one, and I'll explain why in just a second. But again, notice that they're circular muscles. So really, both of those muscles are sphincter muscles. They're sphincters. We tend to think of sphincters being in our digestive system. That's kind of what we associate sphincters with. But we do have some other sphincter muscles, and the Orbicularis ones are sphincters. And what you note about sphincter muscles is that when they're circular, those muscle fibers, they make a loop and they attach to themselves. So one end of the muscle fiber just attaches to the other end of the muscle fiber and makes a circle. And when circular muscles contract, what happens? The circle shrinks. All right, we make that circle smaller when the muscles contract. So if we contract orbicularis oculi, what are we doing? We're squeezing the skin closed over the eye. So think if you really scrunch your eyes up tight, closed, right? And you're scrunching up all that skin around your eye opening there, that is orbicularis oculi. It's closing the skin, tightening the skin around the eye opening, right? Orbicularis oris, same thing. That is going to squeeze your lips shut. So it doesn't have anything to do with you opening and closing your mouth. We're not moving the mandible at all. None of that's happening. What we're doing is closing the skin around your mouth. So think if you purse your lips, right? You make a tight circle with your lips. That is orbicularis oris. It's just closing the skin around your mouth. All right. So that's those two. And again, I would outline those areas if I wanted you to identify those. Now, with orbicularis oris, why can we not really see the edges of this muscle at all? Like we look here, and I'm just going to say that orbicularis oris is like something like this, right? Like here, we can see this little bit. That's kind of the edge of it there. And then it goes this way here underneath of some of this fatty tissue, right? Like this, and goes all the way around. Why can we not see the edges? We can't because most of your other expressive muscles that move the lips around, what do they attach to? They use orbicularis oris as an anchor point, right? So think when you smile, you frown, you lift up your upper lip, you lower your lower lip, anything you're doing where you're manipulating the skin around your mouth, right, is all going to be these other expressive muscles. And what do they pull on? They pull on orbicularis oris. So they all attach to that as an anchor point. So that's why we can't really see the edges of this really well, because we have a lot of muscles that are pulling in different directions on orbicularis oris. Okay, so next muscles we're going to go to are the Zygomaticus muscles. And we have two of these. We have Zygomaticus major and Zygomaticus minor. All right, those two. And here, first off, we look at that word zygomaticus, all right? Has the base zygomatic in there, and there is a bone on your face that is your zygomatic bone, and that's your cheekbone, all right? Your cheekbones are your zygomatic bones, all right? So zygomaticus muscles, they attach to your cheekbones, right? And then we have two of them. We have a major and minor. That just means the one is larger and the other one's smaller. All right, so your zygomaticus muscles are your smiling muscles. They're the main ones. So we want to look for a muscle that goes from the corner of your mouth, right? And we're going to call the corner of your mouth the angle of the mouth, right? So we're looking for a muscle that goes from the angle of your mouth up towards the cheekbones, and that is going to be this guy right here, right? This muscle that I'm moving around right there. We can see if we lift up orbicularis oculi, get that up out of the way, that we see this muscle stops like right there, and I'm on top of the zygomatic bone right here. So from the cheekbone down to the corner of the mouth, that is Zygomaticus major. And you can see if that one contracted, right, what are we going to do? We're going to lift the corner of your mouth up and out a little bit, and that's going to be a smile. So the only muscle you need to smile is going to be Zygomaticus major. Now, superior to that, so we're going to move up a little bit, will be Zygomaticus minor. Now, you're going to note that Zygomaticus minor is another highly variable expressive muscle. So again, we said they're all variable, but in particular, Zygomaticus minor is another really, really variable one. Some people have well-developed Zygomaticus muscles, Zygomaticus minor muscles, and some people are missing it, all right? So in this particular case, we have a very, very small Zygomaticus minor muscle. So you see this little thing that I'm moving here. This is a vein, all right? So I'm just going to get that vein one way or the other here, kind of move it out of the way and get this down. This is a nerve here that we're going to let that kind of fall down. So I'm just going to move this vein over. And right here, what I'm going to do is pull on, we said that this was orbicularis oculi, right? And I'm going to move this a little bit and look at right along here, all right? See how most of the muscle goes up this way, right? So here's orbicularis oculi going up like this. But a little bit of this muscle, right, goes this way instead. And we should be able to see this if I kind of move the lips a little bit. I don't know if I can get it. Maybe I'll just do it right here. See this part that I'm moving right there that is attached over here? That little bit there is going to be Zygomaticus minor. So it's going to originate on orbicularis oculi. So it starts here and it curves around to go to the lips like this. So here's the edge of Zygomaticus minor. Now, right next to that, we have another muscle right here that's kind of connected to it, and that's a different one, right? But just this little bit right here, like this, is going to be Zygomaticus minor. So the way I would show it, this one, and again, the picture is, it's very, very slight, is I would say we have a muscle that begins on this muscle here, and it travels this way, like this, showing you going down towards the lips like that, and that would be Zygomaticus minor. And again, is a very, very poor example of this one on this particular body because it's really, really underdeveloped. But it is there, it's just very, very slight. All right. So again, it's going to work the same. It's still going to pull up on the side of your mouth. It doesn't attach quite to the corner, but maybe like right around here, right? And it just changes the way you smile. So somebody that has a more developed Zygomaticus minor muscle is going to smile in a different way than somebody who has no Zygomaticus minor muscle and only Zygomaticus major. Right? It's going to change a little bit. Plus the fact that Zygomaticus minor here on this particular body is attached to Orbicularis Oculi. That means that when they smile, it's also going to pull the corners of their eyes over a little bit. So it's going to crinkle up some of the skin here in the corner of their eyes when they smile. Where if a person is missing Zygomaticus minor, when they smile, it may not move the skin around their eyes at all. And it's just, again, because of the fact that the muscle might not be connected there, they might not have it. All right. So those are those two. And again, the easy one to identify is major, and then above that would be minor. And again, the picture is really bad. So if I was going to show it to you, I would relate it probably to this one. I'd say, listen, we have two muscles here. We got this one, and then we have this one related to it right above it. I want you to identify this one. So, somehow if you could look here and know that this is Zygomaticus major, and I'm associating something with that, it's Zygomaticus minor. I would ask it in a way that it would prompt you to know which one you're talking about there, as long as you know we have those two muscles next to each other. All right. Next muscles, let's do the Anguli Oris one. So we're going to do Levator Anguli Oris and Depressor Anguli Oris. All right, so a little bit of a longer name, right? But it's really telling you exactly what it's doing and where it attaches, right? So think of the second part of the word, anguli, or the second part of the muscles, anguli oris. It's telling you the angles of the mouth, the corners of the mouth. These muscles attach to the corners of the mouth, and what do? Levator anguli oris moves the corner of your mouth up. Depressor anguli oris moves the corner of your mouth down, right? So they're going to elevate and depress the corners of your mouth. So think like a slight smirk or a frown, right? Just moving the corners of your mouth up or down a little bit. So when we're finding these muscles, what I typically do is grab the corner of the mouth and move it up or down. And look at here, as I move this up, look at how I'm stretching out a muscle right here. See if I outline this, and we'll just make a little line right there, kind of outline it like that. And there's a triangular muscle right there. You can really see when I do this, you can see how that muscle is moving a little bit, right? This is Depressor Anguli Oris, a triangular muscle that goes from the corner of the mouth down and attaches along the bottom of your mandible, the bottom of the jaw right there. And the bottom edge of the jaw, I'm pushing up against it right here. All right, so that triangular muscle, that is Depressor Anguli Oris. Now, if we go the other way, so I grab the corner of the mouth and I move it down, right, you see this muscle right there, right? See that one moving? That is Levator Anguli Oris. This one. And where do we find that one? In between Zygomaticus major and Zygomaticus minor. In between those two is where you're going to find Levator Anguli Oris. Okay? So we got those two, right? Depressor and Levator Anguli Oris. Again, moving the corners of your mouth up or down. The next muscles we have, and these ones, the pictures of them are not great. And that's fine. They're just, you're going to have to, I'm going to show you where they are. You're going to take my word for it. I'm going to show you how I will point it out on the practical, but know that you're not going to be able to discern these muscles very, very well. And that's going to be ones that move your lips up and down, right? And that's going to be Levator labii superioris and Depressor labii inferioris. All right, so again, long names, but it's telling you exactly what they attach to and exactly where they are and what they do, right? So when we're talking about the labia here, we're talking about your lips, all right? So that's where labii comes from. And levator labii superioris is telling you it elevates the lips, pulls the lips straight up, and it's located above your upper lip, right? So that's the levator and the superioris part up here. Depressor labii inferioris is telling you it's below your lower lip and it's going to pull it down like that. So these are they're a little different from the anguli ones because instead of only working on the angles of the mouth, they work on the lip as a whole. Okay, so they're pulling the whole lip down, not just the angle, but the whole thing or the entire upper lip up, right? So for these, let's look at the depressor one. Okay, so here we said I'm just going to make that line again. So this was Depressor anguli oris here. If we go just medial to that, right here, okay, and I'm going to outline this area, right here, in here is where we have Depressor labii inferioris. And you can, I don't know how well this shows up, but hopefully you can see right here, right, that the fibers are going in this direction. Like that there. So you see these fibers here are going in this direction over towards the corner of the mouth, but Depressor labii inferioris right here. And I think that shows up a little bit, right? You can see a little bit of striping there, Alex, maybe? Touch. I know it's not super clear, but maybe you guys can make it out a little bit, but the muscle's going this way, like this. So I would outline it right like this here. And then on the other half, we'd have, on this side, we'd have the same thing on the other side, right? So it's attached here, 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 and it's going to pull the bottom lip like this down. All right, and on the other side, it would do the same thing on the other side. So Depressor labii inferioris there, and then levator labii superioris, that's going to be all of this up here. So let's move this out of the way a little bit. See, get this up out of here. All of this that I'm outlining right there. Now, connected to that, it's right next to, see, this little part here was that Zygomaticus Minor. The rest of all of this next to it here, this whole thing here, is all levator labii superioris. So it goes down and it pulls this way on Orbicularis Oris. So it's attaching right to Orbicularis Oris right here, and it's going to pull on that and lift that upper lip up this way. And again, on the other side, we would have the same thing pulling up that way. All right. So again, I know the pictures on these are not great, but pay attention to where I'm outlining, what I'm saying it's attached to and everything, and how I show it, and that'll help you differentiate here. And what else do we have here? Risorius, is that the only one? Other one? The expressive one? Right? Yeah. All right, so the last one that we have here is a muscle called risorius. All right, and we're going to do this one in conjunction with another muscle called platysma. Okay, so platysma is an expressive muscle that covers over your anterior neck. Risorius is a muscle that is associated with platysma that is up on your face. All right, so we're going to kind of put these two together because they're related to each other. You're going to make a note that of those two, risorius is highly variable. You may or may not have it. We have a very, very small, poor example of risorius on this body. Lots of cadavers we look at have no risorius muscle whatsoever, and a couple here and there have well-developed risorius muscles. This particular cadaver has a very, very underdeveloped risorius muscle. It's barely there. All right. So let's start with platysma, because platysma is the one that is always there. You're going to see that one. That's going to be on everybody. So let's start there. So we're just going to move down just a touch here. And you see this very thin muscle that I'm moving right here. You see how it covers over the anterior neck, and you see how like paper thin it is, right? That is platysma. So platysma is a muscle that covers over the anterior side of your neck, right? And then we'd have another one on the other side. You can see it over here. I'm going to lift it up a little bit. See on the other side, right? And again, you can see right there along the edge of it how thin that muscle is. Well, platysma kind of lays over the anterior neck like a blanket, right? So that covers here. Risorius, if we follow platysma up, we can see that most of these fibers, see all these guys? they're going from the mandible, right, the bottom of your jaw, and they're going down over the anterior neck towards and laying over the top of our clavicle right here. So they're going down towards our chest. All right, that would be platysma. So most of the fibers are going this way. But some of these fibers over here, instead of going this way, they go this way, horizontally towards the ear. And that would be some of this stuff that I have right here. Now, this is mostly fascia. And I know for sure this is not, I can see, this is not showing up real well. But if you see like this part of the muscle here, like these couple of fibers, these fibers are actually coming over towards me instead of going down that way. And that little bit right there would be a very, very small example of Risorius. If this was bigger, that band would be a little bit wider and we'd see a bunch of fibers going this way over towards your ear here. And that part of it would be Risorius, right? So the fibers that are going down that way, all that's platysma. The part that's going this way, Risorius. And again, it's an extremely small example of it. If you guys were here in person, you could get up really close to this, you would see it a little bit better, but I can see on the video it's not showing up that much because it's so slight. All right, but that would be where Risorius would be. So these muscles again are expressive. So either we're going to tighten up the skin here or we're going to tighten up the skin here. And again, Risorius is one that a lot of people, I would say the vast majority of the population cannot voluntarily control Risorius unless you have a really well-developed one. But platysma you can. That is when you tighten up the skin in your neck. So kind of, if you, it helps to like lower, like kind of pull down the corners of your mouth a little bit. Yeah, I'll show it. You guys have all done this, but let's put it up on me for just 1 second. I'll demonstrate. Oh, if I can do this here. Sorry. Like this. Can you see me? Like there, like that. Like so. If I go like this, right? You can see that skin jumping on my neck. That is platysma. Okay. Sorry. Let's flip this. Come on. Get back to where you were. There we go. So we can get that one. All right. So that again is just an expressive muscle on your neck. It tightens up the skin on the anterior neck there. All right. So we got that. So I think, pretty sure that's all the expressive muscles. If I remember one later on, we'll come back to it, but I'm pretty sure we hit them all, right? Can you think of anything I missed there? Yeah, we got it, right? All right. So that's done with the expressive ones. So now we're going to go to the functional muscles. And we're going to start with the functional muscles that are up on the face, all right? So we have two that we're going to begin with, and these are the ones that close your mouth, that actually move the mandible up towards the maxilla up here, right? So your lower jaw is your mandible, your upper jaw is the maxilla, and what brings those two bones together, those are the next two muscles we're going to look at. And that's going to be temporalis and masseter. Temporalis and masseter. These are your gum chewing muscles. So right now, just clench and unclench your jaw. Like close your mouth and just squeeze your teeth together and relax. And where do you feel muscles activating? You're going to feel a muscle activating on the back corner of your jaw. And you're also going to feel a muscle activate up on the side of your head up here. So these are your two gum chewing muscles here. The lower one being masseter, which I'm going to outline to show you a little bit better, and the upper one up here being temporalis, which should make sense, right? That's your temporal bone up there. So we have a muscle that covers the temporal bone. That's temporalis. The one that's down here on the back corner of your jaw, right, is masseter. So we got those two muscles. So let's look at these a little closer. So let's come over to the side a little bit more. Sorry, I gotta readjust here. This. It's a little hard to adjust for the swing of the camera arm here. Get it just in the right spot. All right, well, that'll be good enough for masseter. Move it a little bit for temporalis. Okay, so again, we're right on the side here. What I'm going to do is take that part that we said was Risorius and part of platysma, and I'm just going to reflect this out of the way. So let's get this over like that. And now you can really see this whole muscle that we're going to outline right here. So you see the muscle belly of it here. You see the tendinous portion there. So we have a muscle that is going from the back corner of your jaw. See, I'm pushing against the bottom of the mandible here, and this is called the angle of the mandible, the very back corner of your jaw. You guys can palpate this. Just feel the bottom of your mandible and go all the way back until you feel that bony corner in the back corner of your jaw. That's the angle of the mandible. Masseter attaches there, and it goes up, up, up towards your zygomatic bone. So we're going from the corner of the jaw up to your cheekbone, your zygomatic bone, and that's going to be masseter right there. And again, I'll outline it like that, right? So when this one contracts, what happens? We pull the mandible up towards the maxilla, closes your mouth, all right? That's going to be masseter. Now, temporalis is more over here, so we're going to try to reposition a little. Let's see if we can get this here. Let's see what we can see. I think that's good. So we're over here on the side of the head, and here we have some fascia, right? So I'm just going to take some of this fascia, and we're leaving this fascia because there's vessels that are in the fascia. See, I'm grabbing like a little artery here. You can't really see some of the lines, but there's some arteries and veins going through this fascia that we're going to talk about at another time. So I'm going to take this, going to reflect it out of the way. So we're going to get that fascia down out of the way. And then we have another little layer of fascia here, which you can see, maybe you see like little veins coming up through here. So a little bit more vasculature. I'm going to move that out of the way. And what we're uncovering right here is temporalis. Okay, so all this darker tissue here, and it's still covered by a little bit of fascia, but if I peel this off, the muscle is just going to rip apart. So I'm going to leave that on there. Temporalis is here. The muscle is attached all along the temporal bone. The fibers, even if you can't see them, are going down this way. This is the direction of the fibers. And they're going to go down, 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 and they're going to pass. See how the forceps go underneath of something right there? See that? Right? They're passing under what we call the zygomatic arch. So it's a bony process that comes off of your cheekbone and goes over towards your ear. And that's called the zygomatic arch. So temporalis is going to pass under the zygomatic arch, and it's going to continue underneath of masseter here. So I've cut masseter out of the way so we can kind of see where this goes. Now I think I'm going to have to maybe come up a little bit here. Sorry for the camera repositions, but it's tough to get this in the right spot so you guys will be able to see this. So let's see something like. Now I gotta get a little closer. Come on now. Why is this? There we go. Sometimes the camera arm is not cooperative. There we go. Something like that. Let's see if we can zoom in a little bit more. Maybe there. Ah, that might work. All right. Let's see. So look at this. So we're gonna take. Here's that Zygomaticus major. I'm just going to move that up a little bit. I'm going to grab masseter. And you see how I detached masseter here, right? I cut it away from the zygomatic bone. So we're going to move masseter out of the way. I'm going to really get this, grab it. I'm going to pull it out of the way. And let's get this down like that. And you see this down here. See this muscle that I'm pushing against? And there's a little bit of connective tissue. There's a tendon. All right, watch this. So we're going to start up here. We're going underneath that zygomatic arch, and look at how, if I can get it in the right spot here. Come on now. Oh boy, doesn't want me. There we go, like that. See? See how we're passing through underneath there, like that, right? And that's where temporalis goes. So temporalis starts up here, passes underneath the zygomatic arch, underneath the masseter, and it attaches to your mandible right there. So this and this are the same muscle. They're just passing under. This really is not wanting to give me a clean. Yeah, see, I'm chewing up that muscle because it's not. There we go, like that, right? Right underneath there. So right here is the top of your mandible, and it's actually called the coronoid process of the mandible. Coronoid process. So temporalis starts on the temporal bone, comes down and attaches to the coronoid process, and it pulls up on the coronoid process in the mandible, which is going to close the jaw. So let's show you this on a skull. All right, it'll be a little easier to see because we won't have all the muscles in the way. Just get this position back in place, kind of like that. Let's show you the same spot on a skull. So let's zoom out a little bit so I give myself a little room. Let me just grab a skull real fast, and I will show you this. Yeah, right over there, I got one. Right, so let's move up a little bit so we can see the skull. Now, we can see that we're kind of looking like this. This is, see, right there, it's like this. So we got the mandible here, right? Here's the maxilla that we were talking about here. Here's the zygomatic bone, right? And then here, look at what my finger can pass under. See that right there? That's the zygomatic arch, right? So when we were doing this, I'm up here on the temporal bone, and we're going under like that, right? Where the probe is going there, that is like me going like this. I'm up on the temporal bone, and I'm passing the probe down that way, right? And that was what we did down here, right? We moved masseter out of the way, and we saw the probe go down, 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 like here, and there is that coronoid process. That's what temporalis attaches to. So temporalis starts here, all those fibers go underneath the zygomatic arch, and they attach to the coronoid process there. And look at how when I open and close the jaw, see how that coronoid process moves, right? So if our jaw was open like this, and boy, I don't think I can hold this and do it all to say, let me do it like this. Yeah, there we go. So if I hold the mouth open like this, if temporalis pulled up on this, it would move it up and close the jaw, right? So when your mouth is open, temporalis closes it. And also, masseter connects these two spots, right? We said it goes from the angle of the mandible up to the cheekbone. So again, when the jaw is open like this, masseter is going to pull on the angle of the mandible like that to close the mouth. Right, so we got those two muscles, and there's a little bit of that bony stuff there for you to be able to correspond to kind of what we saw down there. All right, that is those. Now, last functional muscle we have up on the face is going to be one called your Bucinator muscle. Bucinator. Power muscle went out. What time is it? Just seeing what time is. Okay. All right, your bucinator muscle is one that is located in the walls of your cheeks. Okay, so right now, take your tongue inside your mouth and just push it against your cheek on either side. Just kind of push out your cheek on either side. And right now, your tongue is pushing against your bucinator muscle. It's embedded in the walls of your cheeks. So let's zoom in a little bit right here. Just a little farther out. Yeah, like that. All right. Something like that. And here, let's do this here. Right. So if I grab the cheek, see I'm moving the cheek around here like this, and really I'm grabbing, remember we said this is the corner of Orbicularis Oris, right? So I'm grabbing Orbicularis Oris, and I'm moving Orbicularis Oris, and look at this tissue right here. See what I'm pushing against right there? See how that's moving when I'm moving the cheek around? That is bucinator. All this stuff in there. You can see if we kind of push, see I'm inside the mouth and I'm pushing against the cheek, that's bucinator down there. All right, so again, hopefully you guys can see a little bit of like the edge of Orbicularis Oris and where that kind of goes into bucinator down there. So Orbicularis Oris is doing this, and then the bucinator muscles are attaching here and going down that way. You can see it a little bit better, again, when I kind of pull up on it like that, right? So what does bucinator do for us? Bucinator provides tension to your cheeks there, all right? And we can use that in a couple of different ways. One is like, say you puff your cheeks out, right? And then you tighten that skin, and that blows that little bit of air out of your mouth, right? That would be bucinator. It would be tightening up your cheeks. Also, if you kind of sucked your cheeks in, right? And then you tried to like expand your cheeks, that would also be bucinator as well. So we can use bucinator to like, again, to like blow a little bit of air out of our mouths by like squeezing our cheeks together, right? We can also use it to suck into our mouths by moving our cheeks away, right, from our teeth. The other way bucinator is used a bunch is when we chew. So when you're opening and closing your mandible, bucinator contracts a little bit to keep the inside of your cheeks away from your molars, so you don't chew up the inside of your mouth. So a lot of things that bucinator is involved with there. Right? And that's the last functional muscle that we have up in the face. All right, so I think that takes care of pretty much everything we need to do up in the face right now. We're going to come back when we do the glands at the end, but let's move down to the anterior neck. All right, so let's zoom out a touch. Let's move down just a little like this. So let me come out just a little bit more. There we go, something like that. All right, let's put platysma back in place. Let's get this all settled like that. So we got platysma back in place. So here we can see, here's the mandible, right? We got platysma coming down, laying over the top of all this stuff. So we already identified that one. So we're going to take platysma and we're going to reflect it. All right, so let's get this guy up and out of the way. Now we're uncovering, we're over here on the right-hand side of the anterior neck. So a couple things here. You guys should be able to see the clavicle right here. Right, that's your collarbone coming over this way. On this side, the clavicle is going to attach to part of your breastplate. We're going to go over the parts of that in a little bit. Other side of the clavicle going this way is going to attach to your acromion process, and that's what I'm kind of pushing down against here. So this is your AC joint that we're on here, which is your acromioclavicular joint, where the clavicle and the acromion process come together. So that one bony interaction there, that joint is the only bony connection that the scapula has. The scapula is completely free to move any way it wants, and the only spot that it's bound at all is by that AC joint where it attaches to the clavicle there. And that's occurring right in this spot, okay? And in a little bit, see this muscle coming down and around this way, this little bit of muscle that we're on here, that is the lower portion of your trapezius muscle that we saw around back. So back here we had trapezius, right? But trapezius comes and attaches right down towards that AC joint, right onto the acromion process and a little bit on the clavicle, and that's what we're seeing right there. This muscle going down this way is part of your deltoid muscle, which we're going to do at another time, all right, down here. So at least you can see that. So there's the clavicle there. So we're going to be concentrating above the clavicle, up on the neck. If we go below the clavicle, we'll be down in the thoracic cavity. So we're going to stay above the clavicle. We're going to be below the mandible and above the clavicle. All right. So here's the midline of the neck here. So that's medial, that's lateral, that's superior, that's inferior. All right. So looking in here, first muscle we're going to do is one that we mentioned last time that we're going to go over a little bit more, and that is sternocleidomastoid. Sternocleidomastoid. That's the first muscle we're going to do here. And that is going to be this guy here. This one, we're going to kind of grab it. See this muscle that I'm moving around right there. That is sternocleidomastoid. Now, there's some things sitting on top of it. See this darker stuff here? This is a vein that's sitting on top, right? This lighter colored thing here, that's a nerve. Sitting on top, we have another nerve over here. Okay, so there's some nerves on it too, but a little bit of vasculature, but you can see the muscle here, right? This whole thing. So this one makes like a V on the anterior side of your neck, because this one's like this, and on the other side, it would be like that, right? Here, here, like that. And this is the one that we related this one to splenius capitis and cervicis on the posterior side. We mentioned this one already, but I said we'd see it again on the front. So here's the rest of it, sternocleidomastoid. Now, the name of that, it's got a long name, but it's telling you its attachment points. Sternocleido, right, are its anterior attachments. Clavicle is the cleidal part. Sterno is the top of the sternum here, your breastplate, right? So sternocleido. And then as we go up this way, this muscle attaches onto the back of your head back here onto something called the mastoid process of the skull. Right? And I'll show you that on the skeleton in a second. Okay, so sternocleido, and then the other attachment point, mastoid. So this muscle moves around your skull, right? And inadvertently, because the cervical spine is attached to that, it's also going to move your neck around too, right? But this one we're going to consider a spinal muscle. So we have to think about the same things we thought about when we did the spinal muscles on the posterior side, which is, are we going to have a bilateral contraction, or are we going to have a unilateral contraction? All right, so let's look at bilateral first. So bilateral would be both sides pulling like this. All right, both sides pulling down at the same time. Now, When we do this, look at where sternocleidomastoid goes. It starts on the anterior side, and it goes back, 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 and it attaches on the posterior side of the skull. So it's actually going to pull, it's going to pull down on the back of your skull. And what's going to happen is we're going to, let me move out a little bit because his cervical spine is pretty frozen. I'm not going to be able to move it much, but I can do this with the bone, with the skull. All right, so let's kind of move out a little bit. I'm going to hold this up in the same position, kind of like this. There we go. So we got sternocleidomastoid here. It's going back, back, back. It's attaching to this spot here. This is the mastoid process on the skull, right? And what it's going to do is pull down on this part. And when it does that, this is going to happen. See? It's going to move the mastoid process down, which is actually going to tilt the chin up. So it's going to do extension or hyperextension of the skull when we get a bilateral contraction. So hopefully that lines up. That's about as best as I can get it there, right? So again, we got the muscle here, up, 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 and I'm just going to change the depth a little bit, but it comes here, like that. Right there is where we are back over here, okay? And again, we pull down on that spot, this happens, like that. So we get extension or hyperextension of the skull when we have a bilateral contraction of sternocleidomastoid. Now, what do we get if we have a unilateral contraction? And we know that unilateral contractions of spinal muscles are going to give us lateral flexion and rotation. Right, those two things. So same thing here. So if this muscle is pulling like this, that is going to be the equivalent of me pulling in these two directions, like that. Let's just move this fascia back into place so we can see the ear here, right? So we're going to pull like this. See how that's going to be? If I pull this way, it's down and horizontally like that. So we got a vertical component and a horizontal component like that, and that's going to give us this. So the vertical component, again, is going to be lateral flexion. So if I grab the ear and I pull straight down, the head tilts towards me. All right, so that's the vertical component. The horizontal component is going to be pulling this way, right? If I grab the ear and I pull it like this, what happens? The head turns away from me, away, right? Opposite side rotation. So sternocleidomastoid, we mentioned this when we saw it on the back, is going to be a lateral flexor and an opposite side rotator. So if I'm on the right, the face is going to turn to the left. All right, and it's going to do both of those things at the same time. It's going to tilt and turn your head at the same time. And watch, if I put the camera up on me, and you guys can do this, look in the mirror, right? Do this yourself. Let's see if I just back up a little bit like that. Tilt it up a little farther. Something like that. That's a little better. All right, so watch what happens. I'm gonna tilt, turn, and you see how sternocleidomastoid pops out on that side of my neck. Here, I'm gonna tilt this way. This will be this sternocleidomastoid, but I'm gonna turn my head the other way. So I tilt, turn, and you should be able to see sternocleidomastoid popping out there, right? Can you see that, Alex? Yeah, coming out, right? So again, it's if this side contracts, right, it's going to laterally flex me towards that side, but turn my chin the other way, like that. And you can see as soon as I tilt and turn, you can really see that muscle pop out, right? This side, tilt, turn, like that, makes that side pop out. So that's how you use sternocleidomastoid. And again, it's going to do both of those things at the same time, because we said that muscles cannot pick and choose what they do, right? They do every move that they're capable of every time, right, at the same time. The only way we get to pick and choose movements is when we contract multiple muscles at the same time and we have neutralizations. So again, always remember that. All right, so that's that one. That's sternocleidomastoid. So we're going to take this guy and we're going to get it out of the way. So let's retract that. Now notice how I'm pulling on these veins a little bit. I think this should be enough. I think this is good enough. We'll be able to see it like that. If I need to, I can always kind of unthread this muscle like this and kind of do that. Maybe we won't. It'll be a little easier to move that around. So I just kind of pulled it out from underneath that vein. All right. Next muscles we're going to look at are strap muscles that are located along the anterior neck. And we call them strap muscles because they look like belt straps, right? That's kind of the shape of them. Now, in order to identify these muscles, we need to identify some structures along the anterior neck first. So once we identify the structures, then the muscles that we're going to do are going to make sense. So we got a couple things we need to find here. So we're going to start on the mandible. So we're going to start right on the tip of the mandible. This is where we have what's called the mental protuberance. That's the very tip of your chin, the mental protuberance, all right, right here. And we're going to start there, and we're going to sweep down along the anterior neck all the way down like this. And we're going to run into, and if I use my finger, I'm going to come down, and I'm going to run into a bony process right here, another one here, and another one here. So we're going to run into three things on the way down. We start at the tip of the chin. We come down, we hit 1, 2, 3 things there, right? And those things in order are going to be the hyoid bone. That's the first thing that we run into, hyoid bone. And that's what I'm kind of up and over right here. And I know you can't see these real well. Why? Because there's lots of muscles covering them. But I'm telling you, there's a bony bit right here, hyoid bone. The next big, you can see this big lump, right, that I'm going over there. That is the thyroid cartilage. That's a part of that. The bump that I'm going over here is the Adam's apple, right? We'll give you a better name for that in a second. And then the third bit that I'm going over down here, this bump right here, is the cricoid cartilage. So again, from the mandible going down, run into three things. Hyoid bone, first thing. Thyroid cartilage, second thing. Cricoid cartilage, third thing. Right? So if I was going to ask you this, and I know you can't see these things really, really well. That's okay. I'm going to say, starting here, I run my finger down, I run into 1, 2, 3 things. I want you to identify the first one or the second one or the third one. So you're going to know that I'm running my fingers over these kind of bony or cartilage bumps. I'm going to number them 1, 2, 3, and then you'll know which one is which. So you want to associate those three things with each other. Hyoid bone, thyroid cartilage, cricoid cartilage. There. All right. Now, note that the hyoid bone is horseshoe shaped, right? Shaped like a horseshoe, and it surrounds the neck this way. Like here's your horseshoe, and it goes around the neck like this. So we're feeling the curve of the horseshoe here, and then the points, they're back on the back of the neck here. We're going to see and be able to palpate the hyoid bone a little bit differently once we are able to open up the throat. All right? You'll see how we'll do that in another week or two. All right. So we got that. Then we come down to the thyroid cartilage. Now, thyroid cartilage is really big, right? I'm pushing against. You see where I am here? If I open my fingers all the way out here, I'm moving the whole neck right now, but I am actually grabbing the sides of the thyroid cartilage. So it's pretty big, see? Like that. So I'm going to outline it for you. And again, you're only seeing a little bit of it, but the thyroid cartilage is really like this big. It's pretty large. Okay? And this is C-shaped, right? Kind of like a horseshoe, but thicker. See, the hyoid bone is really thin. It's only like that big, right? Real thin little bone here. The thyroid cartilage is like a lot thicker, right? So imagine if I had both of my fingers on either side and surround that whole area like that, right? That's what the thyroid cartilage does. And then if we go down, then that last bit down here is the cricoid cartilage. And that one's a little smaller than the thyroid cartilage, and it's right there on either side here. All right, so what are we going to note about these spots? First thing you're going to note, hyoid bone is your floating bone. All right, it's not connected to any other bones in your body. It is suspended right here by muscles. So we have some muscles located above the hyoid bone that are going to hold it up this way, and we have some muscles that are located below the hyoid bone that hold it up that way. So the muscles kind of suspend that bone there. So it's called your floating bone, and it's held in place by muscles. Okay. Going down, the thyroid cartilage, this is what houses or contains your larynx. So you're going to associate the larynx with the thyroid cartilage. Right? So inside of the thyroid cartilage is where your larynx is. Now, this is going to make more sense when we talk about the Adam's apple. That bump that everybody calls the Adam's apple on the front, the better name for that is laryngeal prominence. Right? So you go, okay, laryngeal. I hear that word larynx in there. Prominence just means it's the part of the larynx that sticks out the most. right? So that bump there, that Adam's apple, laryngeal prominence. So that right there is the most anterior portion of the larynx. And you want to note that the laryngeal prominence is what your vocal folds attach to, okay, on the inside. And that should make sense as to why males have a larger laryngeal prominence than females. It's not that females don't have an Adam's apple, they do, right? It's just flatter. It doesn't stick out as much. Males, it sticks out much more. And if we think about the fact that the vocal folds are attached there, that makes sense, right? So prepubescent boys and girls, their laryngeal prominence is approximately the same size, right? Which is why the voice of a young girl or a young boy is pretty similar, right? But post-pubescent, when males have that surge in testosterone during puberty, the thyroid cartilage undergoes secondary growth. So we get rapid anterior growth of the thyroid cartilage, which in turn elongates the vocal folds and deepens the voice. Where post-pubescent girls don't undergo that change because they don't have that elevated level of testosterone. Therefore, their vocal folds, prepubescent, post-pubescent, are relatively the same. Now, girls do grow, but the shape of the thyroid cartilage grows like kind of uniformly. It just doesn't change shape, right? Where on a male, it's completely different prepubescent and post-pubescent. And then we get that rapid elongation of the vocal folds. All right, so we got that there. And then the last part, that cricoid cartilage down here, what you want to note about that is that marks, it's a landmark between the larynx and the trachea down here, right? So if your finger is on the cricoid cartilage, you are right in between the larynx and the trachea. So you can think of it either way. I typically think of it as the beginning of the trachea. But you could also think of it as the end of the larynx if you want. It doesn't matter. Just note that if I'm on the cricoid cartilage and I go superiorly, I'm in the larynx. If I'm on the cricoid cartilage and I go inferiorly, I'm on the trachea. All right, that's what you want to know about those spots. Now that we have those spots, now we can identify some of the muscles around this area. So you're going to note that we're going to divide these muscles into two categories: suprahyoid muscles and infrahyoid muscles. We go listen to that and you go, oh, all right, that makes sense. Some of these muscles are going to be located above the hyoid bone, suprahyoid. Some of them are located below the hyoid bone, infrahyoid. Right? Now, I'm going to zoom in just a touch, right, just so we can see this a little bit better. Something like that. All right, let's grab these guys. So we're going to start off with infrahyoid. That's where we're going to begin, infrahyoid muscles. And we're going to start with these two right here. All right, see these two muscles that I'm moving right there? And there's a little bit of fascia holding them together, which is good. I'm going to leave them like that because I'm always going to identify these together, right? But you see how we have the one muscle, this one, is kind of going straight up and down, right near the midline of the neck, and then the other muscle is going more obliquely, right? So we can see a little bit there. You can see more of that muscle down there, right? These two are going to be sternohyoid and omohyoid. Sternohyoid, omohyoid. Now, look at sternohyoid, the one that's going up and down here, and it's telling you what it's attached to. It originates on the sternum, and it goes up to the hyoid bone, right? So this one here, sternohyoid, right? Omohyoid, omo has to do with your scapula, all right? So this one is originating way down there, way down in there. There's more of the muscle. We're not seeing all of it. It continues down here a bit. You can see pushing the probe down in there, right? It originates on the scapula back there and comes up, 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 up to the hyoid bone here. That would be omohyoid. Now, also note, when we're looking at omohyoid, let me just get this vein out of the way a little bit. We can move this. See that? Right here. Look at this. Right here. This muscle is segmented. It has a superior portion and an inferior portion with a little bit of tendon in between. So you guys can see that. It's a really nice picture of that segment right there. You can see right here is the break in between the two parts where we have tendinous tissue, right? So omohyoid has a superior segment, an inferior segment or part or belly, however you want to describe it, right? And we can see where that division is right there, All right, so it's another segmented muscle. All right, so we got those two. We'll talk about function of these when we're done with all the infrahyoid muscles because they all have similar function. So if we want to see other ones, we have to move these two strap muscles out of the way. So we're going to reflect these guys. So we're going to take them, and we're going to reflect these down out of the way like that. All right, and once we move those two, we uncover a couple more muscles in this area. Now, the next two we want to look at are sternothyroid and thyrohyoid. Sternothyroid, thyrohyoid. And this is really telling you where these muscles go, right? So sternothyroid originates on the sternum and comes up to the bottom of the thyroid cartilage. And that's going to be this muscle, this one that I'm moving right there. That is going to be sternothyroid, okay? So again, it goes from the sternum up to the bottom of the thyroid cartilage right there. And I've detached this one so we can see some other things, but that is sternothyroid. Now, the rest of what you're seeing here, and I'm going to outline it, see this guy right here, and you can see I can kind of grab it. I'll just move it a little bit. This guy right here, that is thyrohyoid, and it's originating on the thyroid cartilage right there, and it goes up towards the hyoid bone right here, thyrohyoid. So these muscles are named for what they're attached to. So we got those two. And in order to see those two, we'd have to move sternohyoid out of the way. See how sternohyoid covers those? See? Like that. So we move that out of the way, and you're allowed to see those two now. All right? Now, we're going to move sternothyroid out of the way, like this. Reflect that. And the next, we uncover two things here. One is this gland right here. This is your thyroid gland. I'm going to kind of outline it for you. You can see me moving it around right there. That's the thyroid gland. So we got that there, and we'll come back to that in just a second. And then if I move that out of the way, we have a muscle right here, and I'm going to outline it here, there, 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 like that. And this muscle is going this way. And I know it looks like this and this are one thing, but there is, and you guys can see this little bit of fatty tissue. See? Right here. This is actually, there's a little bit of fat, but what I have here is an artery and a vein, right? And that artery and vein is running right on the border of those two muscles, right? So from here up was that thyrohyoid muscle. From here down is the other one we want to see here, which is cricothyroid. Cricothyroid. And that is a muscle, again, that is going in this direction, right? From the cricoid cartilage here, this way towards the bottom of the thyroid cartilage. So it's like oriented like this a little bit. Again, I'll kind of outline it right there, cricothyroid. Okay, so that takes care of the infrahyoid muscles. You want to know, what do all of the infrahyoid muscles do? They pull the hyoid bone down. This is involved in lots of different things. The most important thing that they do is swallowing. Right? When we swallow, and you guys can do this right now, put your finger on the anterior side of your throat. Specifically, try to feel your Adam's apple. Right? Try to feel that laryngeal prominence. Just gently palpate it and then swallow. And you'll feel that the Adam's apple goes up and then it drops back down again when you swallow. Right? So the first thing it does is elevate and then it depresses. And that is suprahyoid muscles pulling it up, that's the elevation part, and then infrahyoid muscles pulling it back down again. So we have coordination there between these muscles that move all of this stuff up and down, and that happens when we swallow, right? Also, when you talk, when you sing, if you change the pitch of your voice and you put your finger on your laryngeal prominence, right? As your voice gets higher, we'll feel this go up a little bit. As your voice gets lower, you'll feel that go down a little bit. And that's also these muscles kind of moving things around and constricting things and changing the pitch and the tone of your voice, right? So talking, singing, that type of stuff, swallowing, that's what all these hyoid muscles are involved in. And specifically, the infrahyoid ones are when we're pulling things down that way. All right. And again, we said that we can see the thyroid gland here. Right, that's one part of it. The other part of it is over on the other side, and a little bit. Let's see if maybe we can. Let's go right up over the top. And I'm moving a little bit, a little closer. If I can just, sorry, I'm giving you kind of a little bit of a weird view here, but let's see. I think we just kind of move this up out. There we go. A little bit. See right there? Right below the thyroid gland down here. You see these kind of ribs sticking up here? That's part of the trachea. Right down here. It's part of the trachea. Right? And these are the rings of cartilage that you're seeing that are present in the trachea. And that's going to continue all the way down that way. Right? Because again, we said here was the cricoid cartilage. And if we go below that, that's where the trachea starts. So you can see that the thyroid glands kind of cup around and surround the very beginning of the trachea there. So again, if we move that up out of the way, you can see a little bit more of the trachea right there. All right. Now let's go to suprahyoid muscles. And I think now that I'm looking at time, so we are going to do, we're going to finish this up. We are going to do the thoracic muscles as much as we can. There's not a ton to do there. And then we will do the rest of the glands, and then that'll be good for today. And then that'll mean on, what day say? Wednesday, right? So that'll mean on Monday, we will be in the thoracic cavity. We're going to open up the thoracic cavity. We're going to get in there. We're going to do the heart, the lungs, and all the contents of the thoracic cavity and start getting into that. And then again, at some point, I don't know if I'll get it done in time for that class, but that would be maybe the next class. We will fit the brain in somewhere. All right, I'm just not sure. I'm going to wait and see wherever it we have a little bit of time and we can hit it. All right, so we're looking back on the side of the neck again. And now we're going to go above the hyoid bone and go to the suprahyoid muscles. Now, I'm going to turn. Right now, I'm looking like straight in on the right-hand side of the neck. I'm going to turn a little bit, so I'm looking kind of up underneath the chin a little bit more. So we're just going to rotate a little bit like this. Just give us a better view of these suprahyoid muscles. Something like, get this in the right spot. There we go. Something like that. Let's see what that looks like. So, again, here's that laryngeal prominence. Sorry, the camera's swinging just a little. Steady it. There we go. Here's that hyoid bone here. So we're going above the hyoid bone. So first muscle we're going to find in the suprahyoid muscles is one called digastric. Digastric. This muscle is segmented. All right, it's an anterior segment or portion or belly. And again, I'm giving you those names because you could call it anything you want there, right? Anterior portion and a posterior portion. Right, so let's find this one. Now, look here. First thing is you see this kind of lump right here. That is another gland. And I'm just going to move this gland out of the way. We'll talk about it later on. This is your submandibular gland, but we're going to come back to it. So I'm just going to lift this up, move it out of the way like that, and create a little space here. And I might, you know what? I think one thing is, see, we got this little vessel going here. I'm going to have to cut this out of the way because it's just blocking our view here. I think, yeah, that's a little bit better. All right, there we go. So I'm going to kind of hold this guy up out of the way, hold that gland, and I'm going to outline digastric for you. Here is the anterior portion of digastric, there, this part. It goes down towards the hyoid bone, right, which is here. It goes down towards the hyoid bone, and then it continues back this way. So it's V-shaped here, there. And I'm going to grab the posterior portion. You can just barely see it right there. See what I'm moving back there? That's the posterior portion of it. So here's the anterior portion right there. And there is the posterior portion back there, right? And hopefully you guys can see, and I know this thing is right in the way here. If we do that, let me create a little space there. There we go. You see that tendinous part in the middle? That is where the segments separate, right? Can't get this to stay up. There we go. So right there. So anterior portion, posterior portion there, and there's that segment right in the middle where it's separated. So that whole thing is digastric, and it forms like a V here. So it starts on the mandible, goes down, passes by the hyoid bone, and then continues up this way towards the mastoid process of the skull, right? Same spot that sternocleidomastoid mastoid is going to attach to. Goes up there, right? So it makes like a little V. So this muscle, when it contracts, both segments pull like that, and that causes the hyoid bone to elevate a little bit. So that muscle does not directly connect to the hyoid bone, but there's a ring of connective tissue, a little like donut, that surrounds the hyoid bone, that this muscle passes through that donut. It passes through the ring, and it pulls up on the ring. So if we're like this, if digastric is like this, it's passing through a circle like that. So here's the ring, right? And digastric is hooking that ring like that and pulling up that way. And the ring is around the hyoid bone. Hopefully that makes sense. But that's how digastric works. Okay? So we got that one, making the V. Again, front part, back part. Now, the other two muscles we're going to identify here, we are going to associate with either the anterior portion of digastric or the posterior portion of digastric. So let's do the one that's associated with the anterior portion of digastric first. And that is going to be a muscle called mylohyoid. Mylohyoid. And that muscle is going to pass under digastric this way. So you can see the anterior portion of digastric right here is going in this direction. Mylohyoid, which I'm going to grab the bottom of it. See what I'm moving right here? That's mylohyoid. Now mylohyoid is going to continue under digastric, see? Like this way. So we can see a little bit of it here, and this tissue that we're seeing right here on this side is part of mylohyoid. So it's going, see, in that direction, like that. And again, we can see the direction of those fibers a little bit there. So mylohyoid's going like this, digastric like that. All right, so it's under the anterior portion of digastric is mylohyoid. Now, there's one associated with the posterior portion. Now I'm going to try, this is going to be a little, this picture just is really, really tight. So let's see if we can get this down a little bit into position, and maybe we can see this here. Don't know how this is going to work. Moving down. Actually, let me just back it out a little, maybe like that. Let's see how this works. Let's see. All right, so if we find the posterior portion of digastric again, which means we got to get this gland up out of the way, and then we got, see this, this is problematic for us here because we have some veins that are kind of covering our view here. Let's see if we can detach this stuff just a touch. Maybe I can detach it. Get this out of the way a little bit. Maybe something like that. Yeah, that might work. All right, let's see what happens here. I don't know. This is going to cooperate and stay. Get this out of the way. Maybe I can come in like that and do that. All right, there we go. So I know this is not the best picture, but right here, I'm grabbing, there's the posterior portion of digastric, right? And just above that, we have another muscle. See this guy right here? So we got one, oh boy, tough to do this on the camera. Two muscles right there, right? That second one that's located superior, this guy right here that's located above the posterior portion of the digastric, that one is called stylohyoid. Stylohyoid. So here is digastric, and then above it, that one right there is stylohyoid. Okay, so you can see the digastric is passing under stylohyoid here. You know what? Maybe let's try something real fast. Wonder if I can just, maybe I didn't get this. Yeah, that's better. I can get that's okay. This will help. 1 second. Just get a little bit of this fascia out of the way. There we go. That's a little bit better. Right? So now you can see there's the tendon for digastric here, and you can see it continuing there. And then you see how this muscle passes over the top of it there. This guy right here. Right? That's stylohyoid. Right there. Okay. So again, associate that one with the posterior portion of digastric there. Stylohyoid. Okay, and again, that's about the best picture I can give you, unfortunately. If you guys were here, you'd be able to see it maybe a touch easier, but even this one, even if you were here, it's a little tight of a picture. It's a little tough to see that one because it's way down in there. All right. So I'm just going to zoom back out again here. Let's put that gland back in place. All right, so that takes care of the suprahyoid muscles, right? And again, what do all those do collectively? They elevate the hyoid bone. And then everything else that the hyoid bone is attached to, which is going to be thyroid cartilage and cricoid cartilage and the trachea and all that kind of stuff, right? Okay, so let's do, I think let's just do the glands here, and then we'll move down to the thoracic cavity, and then we'll just finish up in the thoracic cavity. All right, so in this area, we already saw the thyroid gland, so we identified the thyroid gland down here. But we also have salivary glands in this area. And you hear that term salivary, and these are glands that produce saliva, right? So we already know where is saliva, where do we see saliva? And that's going to be inside the mouth. So the salivary glands, they produce saliva, and then they have ducts that carry that saliva into the mouth. So we're going to find these couple of glands, and we're going to see how do they get the saliva from the gland into the mouth via a duct. All right. So for your salivary glands, we have 3 pairs of salivary glands. And going from largest to smallest, it's going to be parotid gland, submandibular gland, and sublingual gland, right? We have 3 pairs. So we're going to see just one side, so we're going to see one of them, but on the other side would be the other one, right? So we have a right and a left on these glands, 3 pairs of glands. Again, parotid, submandibular, sublingual glands, all right? And again, that's going from largest to smallest. All right, so let's find them. So if we put platysma back in place, right? Platysma here, and we move this part of it out like that. The platysma pretty much covers up a lot of the stuff that we want to see here. So we do need to reflect it. So I just want to start from normal, regular position here. We're going to flip platysma out of the way over here. We're going to get it over like that. And now we uncover the first 2 glands. So right here, I'm going to outline it for you. And outlining it for you right here, this is parotid gland. Now I know it looks a little fatty. I'm going to grab it. So this whole thing that I'm moving right there, all this is parotid gland. That's the biggest one. And look at where it is. It's located between the back corner of your mandible and your ear. Nestled in between those 2 things is parotid gland, that whole thing. Then the next one was the one we moved out of the way before, which is this guy, and that is your submandibular gland. And look where it's located. Here's the bottom of the mandible right there, and it's located right below that. So submandibular means it's under the mandible. So parotid gland here, submandibular gland there. And that's the biggest one, and then the medium-sized one, and then the small one, sublingual, that we're not going to see that one, but you're going to note where it is. It's located in your mouth, under your tongue, as the name suggests, sublingual, under the tongue. All right? And it's much, much smaller. So we won't be able to see that one, but it's in there. All right, so you got those 3 pairs of glands. Each gland has an associated duct. So we're going to have parotid gland, we have a parotid duct. We have submandibular gland, we have submandibular duct. We have lingual gland, sublingual gland, we have sublingual duct. All right, so of those, we're going to be able to see the parotid duct really well, the the parotid, I don't know if I said gland, parotid duct very well, the submandibular duct, okay, and the sublingual duct, not at all. All right, so let's find parotid duct first. So we got parotid gland here, again, this whole thing, right? And then we come right here, and what I'm under right there, that is the parotid duct. All right, so the saliva is produced here. The saliva enters into the duct that way, goes over, and what does the parotid duct go through? It goes through your bucinator muscle, pierces through the bucinator muscle to get inside your mouth. Okay? You can see if I move the cheek here, you can see that duct moving a little bit, right? Because it's connected to it. So parotid duct goes from the gland through the bucinator muscle into the mouth that way. Now, submandibular duct, let's see, how can I show this? Yeah, we can see it a little bit there. So I'm going to take the gland, I'm going to move the gland down, and you see this, that little whitish part right there. That's the beginning of the duct. And see, I'm grabbing the duct right there. And the submandibular duct is going to go up under mylohyoid muscle. So the submandibular duct is going to go from the gland. The duct is going to pass up under your mylohyoid muscle. It's going to go through the floor of your mouth and enter into your mouth underneath your tongue. Okay, so we can just see the beginning of the duct right there. That's it. So I said that's going to be a little bit of an iffy picture for that one. But you're going to know where it goes. Under mylohyoid, passing through mylohyoid to get through the floor of your mouth, and it's going to emerge underneath your tongue. And then the last one, sublingual, the gland and the duct are both located under your tongue. So that saliva would just come in directly inside your mouth underneath your tongue. All right, so those are your saliva glands. They all produce saliva. And note their position, all right, because they are positioned in such a way that when you chew, these glands are squeezed or milked. All right, because the glands themselves, while they can produce saliva, have no ability to eject that saliva on their own, right? So they just kind of produce it, it sits in there, and in order to get the saliva into your mouth, these glands have to be squeezed, right? So what happens? When you chew, you open your mandible, and let's use this skeleton again, right? And when I open my mandible, right, the jaw swings down and back. Right, down and back. And look at where parotid gland is going to be located here, right? So here's the back corner of the jaw. And let's zoom out just a little so I'm not so close with the skeleton. So I need a little bit of depth of field here so we can do this little exercise, right? So something like that. There we go. All right. So we're like this. Here's the back corner of the jaw, which is like right there, right? And if we kind of frame that, see right there? Look at where the parotid gland is here, which would be right up in here. Look at what would happen. As I open the jaw, see how that would squeeze the gland down there? Is that kind of working visually? Okay. So every time we open up our jaw, we squeeze this gland in between the back of our jaw and our ear. That's going to squeeze out saliva. Look at where the other one is. See here? Here, look at what happens. If I move the jaw down, what am I doing? Pushing down against the submandibular gland. And it's going to squeeze the gland between the bottom of the jaw and the hyoid bone and the thyroid cartilage and everything. And it's going to squeeze it that way, which is going to push saliva out. And then when you're chewing your food and you're moving your tongue around inside your mouth, you're stimulating that sublingual gland to also squirt out a little bit of saliva in your mouth. So the act of chewing is what is going to get the saliva from the gland through the duct into your mouth. Okay? All right, that takes care of that. So let's move down to, okay, all right. Do I want to start thoracic? Maybe we'll just do that next time. Or we're going to stop it there. Let's stop it there. That way we'll keep the thoracic cavity all in one. It's all the muscles. We're going to get through them pretty quick. We have a little bit of osteology to do. So that's the problem. Right now, I'd have to do some osteology plus the muscles, and I think that's just going to make this a little bit long for this kind of portion of what we did. So let's stop it there. It's a nice stop point. We kind of finished all of that stuff. We can be done with the head and the anterior neck kind of, and then next time start down on the thoracic cavity, which we will begin with osteology. I think if you can, now you have the whole weekend, right? This is a good time to go back and do a little bit of the osteology video for the stuff that's going to be on the midterm practical. Do that. Look at some of the stuff we've already talked about. Hopefully going through the video, you're going to go, oh, okay, I heard this term, heard that term, heard this term, heard that term. And you can really circle those things and go back to them, right? And make sure you know them well. You can also do a little bit of preview of the thoracic osteology, right? A little bit of looking at some of that stuff, like the sternum and the ribs and stuff. And we're going to touch on some of that next time. We'll do all the muscles. Then we're going to open the thoracic cavity, and we're going to get our first look at the heart, the lungs, and all the thoracic contents. That's where we're going to go. All right? At this point, later, it's a little busy. I'm going to really try to get the first quiz or two knocked out before Monday. So I'll record them and send them out to you guys. If not, I will get caught up next week. All right. It's just the only thing with I teach or not teach. I coach a high school track team, and this is like the very, very end of our season. We have all of our championship meets, and I'm just this week is a little crazy, right? I just gotta get done with this week, and then I can get to all that stuff and we'll get caught up. But I will try to get that done over the weekend, get those quizzes started, and then you'll see. Once I do them, you'll have the instructions on how to do the quiz, and you guys can start practicing those as well. All right. So I'll have a help session this afternoon. So jump onto that if you have any questions, concerns, need any extra help. And always remember that you can contact me in addition to that if you need times outside of those scheduled help sessions. All right. So have a good one. I'll